Hi, everyone. Welcome to our June 20th Teal Talk Live. I'm Mary Wheatley, and I am so glad to be here with Dr. Elizabeth Volkmann from UCLA. Hi, Liz. How are you?
Good. Hi, Mary. I'm really happy to be here today.
Thank you so much for joining us during Scleroderma Awareness Month to help us raise awareness all month long about scleroderma. And as you know, this month's theme is Let's Talk About Scleroderma, and we're using the hashtag Teal Talk to help communities engage in discussion around this disease. Maybe we could get started today by you sharing a little bit about who you are with our community and how you got started in scleroderma.
Absolutely. So I'm an adult rheumatologist at UCLA in Los Angeles, and I care for patients who have systemic sclerosis. And I also do a lot of research in scleroderma, both clinical research and lab research too. And I got into this field actually when I was a medical student at UCLA. And I was caring for a patient in the hospital, a young woman who was only 17 years old, and she had pretty serious scleroderma. It was affecting her heart, her lungs, her kidney. And I just, to me, was just so amazed with, despite this woman's challenges, she was so strong and so resilient. And I thought, this is the disease that I wanted to work with, because I felt like there was so much more that we could do in terms of research to help patients like her. And I just really got inspired in that moment. And I was fortunate to be practicing in a place where UCLA has a long tradition of caring for patients with systemic sclerosis, and we have experts who are not only rheumatologists, but pulmonologists, gastroenterologists. So I've learned a lot from all of the people that I've worked with, and I've learned the most from the patients with this disease.
We're so grateful for the work that you are doing in scleroderma. And I know that you're really engaged in obviously patient care, but also in research. Can you tell us a little bit about what the support from the foundation for your research career has been like?
Yes, so I'm delighted to say that the first research grant that I ever received as a physician came from the National Scleroderma Foundation. And this was when I was new as a faculty member at UCLA. And when you start out in academic medicine, it's quite challenging to get research grants. This helps protect your time so you can really focus on research and balance that with seeing patients. And the only way, your supervisors will let you do this is if you have funding. And so I was very fortunate that my first grant came from the National Scleroderma Foundation. And I really credit this grant for getting me started in this field. In fact, if I hadn't gotten it, I'm not sure if I would be here today. And the data that we actually generated from this grant, it was looking at long-term survival of patients who participated in two of the biggest clinical trials in scleroderma, the scleroderma lung studies 1 and 2. We continue to use these data when we're looking at biomarkers for scleroderma and other predictive factors. And so I'm quite grateful for the foundation for this, because again, I'm not sure if I would be here today without it.
Oh, well, thank you for sharing a little bit about that and about your experience with the research grant program. It's really cool to hear some of the high level outcomes that have come out of that and how you're still working on that same kind of line of research today. What do you think are some of the most promising research directions in scleroderma right now?
I think what's very exciting is that there's a lot of interest right now from the pharmaceutical industry in developing new therapies for systemic sclerosis. So when I first started in this field, we did not have any valid therapies for systemic sclerosis. And now we have two FDA approved therapies, and we have other therapies that we use off label that have been demonstrated to be effective. And now we have a number of clinical trials that are available to patients. So I think this is one of the biggest advancements that I've seen in the time that I've done this, is that there's now treatment options for patients. And so patients don't have to feel like they have an illness that's untreatable. There's actually a lot of options out there. And I think there will continue to be as we learn more about the disease.
That's incredibly encouraging and something that we've been obviously tracking as well with our community, and that we'd love to see the interest and just the progress that's been made even in just the last 3 to 5 years. So thank you for sharing that. And we continue to be encouraged by the interest in the field. as you think about your career and the impact that you've had in scleroderma and seeing others join the community, what's one thing that you wish others in the healthcare industry knew about scleroderma?
That's a great question. And I think that one of the challenges that I see a lot of patients face is delays in their diagnosis. So many patients will report having an experience where they start out with having certain symptoms that may seem very nonspecific, like fatigue or brain fog, and they'll start going to physicians, and sometimes they are dismissed by these physicians, or they're told this is just due to stress, like you need to relax more. They're told a lot of different things, and then this can lead them to not getting diagnosed with scleroderma in a timely manner. Sometimes they're even diagnosed with other autoimmune diseases like rheumatoid arthritis and lupus that are a little bit more common, and then started on the wrong therapies. So one of the things that I think is highly important is not only educating patients, but also educating other healthcare providers to recognize the early signs and symptoms of systemic sclerosis. And there's a lot of research now into understanding what those early signs are. Even before a patient has scleroderma, what can you look for that could maybe like give you a sense of whether they'll develop it in the future? And I just always encourage rheumatologists that if you have any question, to refer a patient to a scleroderma center, because there they'll have a lot of experts who will be able to weigh in and really help guide the patient.
Absolutely. Well, thank you for that. And of course, you can always find scleroderma centers on our website at scleroderma.org. Liz, we do have a question in the chat. So digital ulcers obviously are something that people in our community deal with quite a bit. And we just have a question about, are there any new trials that are focused on this, or any research coming out that can help give hope to people living with this?
Yeah, that's a great question. And I think, the existing therapies that we have for digital ulcers really target the blood vessels and trying to get the blood vessels to open to promote blood flow. But now there's also interest in looking at other types of targets that could reduce inflammation, because that also might contribute to the digital ulcers happening. So now with a lot of clinical trials that are being designed, and I'm fortunate to be involved in the design of a lot of these trials, they're including digital ulcers as endpoints in these trials, meaning they're looking to see whether the treatments that they're studying will affect digital ulcers. And this wasn't done before. And now I think we're getting better at assessing digital ulcers, how they change over time. So hopefully there will be new therapies in the future, because I realize this is a really troubling part of scleroderma associated with a lot of pain and disability. And I'm hopeful that we'll have some new therapies soon.
Wonderful. Thank you for that. I know that the folks that are watching online really appreciate your expertise and just your responsiveness to questions like this. So we've got just hearts coming in online. Thank you to everyone who's watching. If you're just joining, I'm here with Dr. Elizabeth Volkmann from UCLA. And Liz is actually a brand new member of our Medical and Scientific Advisory Board, but a longtime supporter, speaker, volunteer, and researcher for the National Scleroderma Foundation. So we're just chatting a little bit about her career in scleroderma and some of the most promising research. We talked specifically about, some of the research that you've been focused on, and then specifically about digital ulcers. But if we think a little more broadly, why do you think there's reason for hope now more so than in the past for people living with this disease?
I think there's a greater awareness now about the disease, and there's also more educational information that's available to patients, in part through the work that you do at the National Scleroderma Foundation. When I get a new patient who's diagnosed with systemic sclerosis, it's usually the first place that I refer them, because there's a lot of information on the internet, and I think it can be challenging to know what is the most reliable information. And so I know if I send a patient to your website, there's going to be only very reliable information on there from experts in the field. And so a lot of times I'll get referrals from patients who self-refer themselves. They've actually diagnosed themselves with scleroderma from reading online and putting together pieces of a puzzle when other doctors haven't been able to. So I think the education part really can help empower patients, and also not only just to have a good diagnosis, but also in terms of the whole disease course. So I'll give you an example. When I first trained, my mentors taught me, for example, for lung disease, you don't screen a patient for lung disease unless they have respiratory symptoms. So don't get a CT scan unless a patient is short of breath or has a cough. And really, we've learned not the correct way to do things. We need to screen all patients for lung disease because we actually want to catch it before a patient develops symptoms, because the body can compensate a lot before symptoms appear. And so, again, I think education is a huge part of this, and organizations like the NSF really help us in that mission. Yeah.
Thank you for that. We have a few more questions coming up in chat. So we know that scleroderma is systemic. It can affect the entire body and multiple systems. One of those, of course, is the respiratory system. And thinking about the relationship between scleroderma and interstitial lung disease, can you just talk a little bit about what we've learned in recent years about that relationship and what patients should know and look out for?
Yeah, so I think that one of the big things is the point that I just mentioned, that you can have interstitial lung disease and not have symptoms. And so that's why you want to make sure that as soon as you get diagnosed with systemic sclerosis, you get a CT scan of your chest to be able to determine if you have any inflammation or scarring in the lungs. Some people even use the pulmonary function test to screen, but again, early in the course of scleroderma, your pulmonary function test can be normal. And so that's a big one, getting diagnosed early. And then the other one is getting treated early. Again, sometimes people thought, okay, well, let's not treat this until a patient gets a lot worse. But then it's hard sometimes to reverse that fibrosis. And by the time, again, someone develops symptoms, sometimes they have irreversible scarring. So we've learned from research that we need to screen for this clinical dimension of scleroderma and treat it early. And I find that when we do these two things for patients, they can have very good outcomes. And there are some of my patients that get started on therapy very early, and then after a few years, we can actually taper them off therapy because they've done so well. But the key is diagnosing it early and treating it early.
Great. Yeah, so important. And another reason why we're working so hard to raise awareness, right, this month. So thank you. Appreciate you digging into that a little bit more. So getting a little bit more into the science and some of the possible pathogenesis and treatment of the disease, we have a question about the role of T cells and how they may play a role in scleroderma. Can you talk a little bit about that?
Sure. So, very broadly, there's different parts of the immune system, and there's a part called the adaptive immune system, and this contains your T cells and B cells. And this is the part of your immune system that's kind of like the memory system. So like if you were exposed to a virus, your body would make these cells. So that way, if you got exposed again, you'd be able to react to that and kill off the virus. And so in a disease like scleroderma and other autoimmune diseases, sometimes these T and even B cells produce inflammation when they don't need to, when there's no virus there. And this can cause inflammation in areas like the skin and the lungs. So I would say the T cells are important, but also the B cells and the therapies that we have now for scleroderma. So for example, treatments like mycophenolate or Cellcept, that they work by decreasing that part of the immune system and decreasing that inflammation. So they do play an important role, and even new therapies being designed target that part of the immune system.
Great, thank you. That's super helpful in a very synthesized way to help us understand, as non-scientists, understand a little bit about what's going on there. Well, thank you so much for being here with us today. And I know people will have more questions, so feel free to put those in the chat and we'll do our best to respond. Just a reminder that, of course, we don't endorse any specific therapy or treatment, but we are here to be a resource to you. And so we have lots of information on our website at scleroderma.org as well. So happy to point you in the right direction there and just help you find your best path so that you can live your best life with scleroderma. Dr. Volkmann, thank you again for being here and just sharing your experience and expertise with our community. We're so grateful for everything that you do in your career to help find a cure for this disease, but also the care that you give to our community and the awareness that you help bring to scleroderma. Thank you so much.
Thank you, and take care, everyone.
Well, thank you all so much for joining today. I hope you'll join us again this Thursday for our Teal Talk table live on Zoom, and you can register at scleroderma.org/tealtalk. And then join me next week where we'll have another special guest joining us, Demetra Newton from the Georgia chapter. Thanks, y'all. Hope you have a great day. Bye.